Hello, everyone. Welcome to Faculty Spotlights for the College of Professional Psychology. Today, we are joined by Dr. Sara Pollard, clinical psychology faculty member for our Dallas program. Welcome, Dr. Pollard.
Thank you.
So, Dr. Pollard, will you tell us a little bit about what inspired you to pursue a career in the field of clinical psychology?
Sure. Yeah. It started with the values in my family. Higher education, science, and helping others were values that my parents taught. My mom was a teacher. My dad studied biology. So academically, psychology was a great fit because it applies scientific methods to
Yep.
understanding and ameliorating human suffering. I had at one point considered graduate study in developmental or social psychology, but ultimately I wanted to have the option to do clinical work. And
Yeah.
I had also watched a close friend and a family member struggle with mental health symptoms during my college years. And so that kind of solidified my curiosity because I really didn't know how to best support them. And that helped me solidify my plan to become a licensed psychologist and do clinical work.
Yeah. Yeah. So we almost, I don't know if I should say this, almost lost you to the pure science of psychology. That's one of the great things about being a clinician, though, right? You're still kind of steeped in the science of psychology, but you do have that flexibility to provide clinical services as well.
Yeah, that's what I love about this, the major or the license and the career is that there's so many different things that you can do. And throughout different stages of my personal life, I've been able to do different things that work with that, but
Hmm.
are still all within clinical psychology.
Yeah, so true. So you've been with the Dallas Clinical Psychology Program for a couple years now, is that
Well, for
right?
4 years, I started as an adjunct, actually, the first time that we
Okay.
offered the systems course to the second years, and then I joined the core faculty 2 years ago. Yeah.
Okay. So tell us a little bit about what it is you enjoy most when it comes to working with students.
Yeah, so I joined because I had recently transitioned from an academic medical setting job working in a hospital and had tried private practice for a little bit in the pandemic, and
Hmm.
I missed the energy of working on a team and having coworkers. And I have found that I just feel really energized by the enthusiasm of my students,
Yeah.
and reading the latest research alongside them kind of keeps me accountable and challenges me sometimes to answer their questions and develop my thinking and stay current.
Yeah.
And then, I'm just about to have my first students that I've met here start to go off on internship. So it's been really neat watching them grow and, starting out as really anxious their first year and now
Yeah.
being confident clinicians and getting to see them develop a dissertation idea that extends the field has been really rewarding.
Yeah, that energizing aspect of students, I think, is really important. Excuse me. But you said something that struck me and really resonated with me because I remember working as a faculty member fairly early in my career and feeling confident about what I knew, but then realizing when you get into the classroom and students started asking you questions, it really does challenge you and your knowledge base. And I realized at that point, I said, oh, I know this, but for me to be able to articulate it in a way externally to help students understand and digest the information, that's a totally different level. So I really appreciated that about being in the classroom, was that
Mhm.
kind of constant challenge that the student feedback gave me to try to better understand my own knowledge base, to expand that knowledge base, and then to find the right way to articulate it to students.
Yeah. I also love that we have a really diverse student body here, and I learn from my students every day. I think that's an
Yeah,
important attitude to have in our field, and I found that to be the case, that the learning goes both ways sometimes.
for sure. When you're working with students, and you talked a little bit about kind of watching students kind of move through the full progression of the program toward internship and graduation ultimately. Is there kind of a lesson, kind of a thread through the program that you hope each and every student comes away with?
Yeah, I think that's a great question. Of course, there's many that probably my colleagues have shared, but for me individually, because I teach the systems course in our
Mhm.
program, That course really helps them develop what is a conceptualization and a treatment plan. So what's your roadmap that's going to guide you to intervening with clients? And I'm also a board certified couple and family psychologist. So for me, a systemic and a trauma-informed perspective is an important lesson I hope that they'll retain. And for me, that means that mental health and problems are not solely residing 100% within individuals, and their solutions are not 100% individual. So we
Yeah.
may need to consider family, society, culture, other contexts.
Yeah.
And in terms of trauma informed, I think often we need to shift from asking what's wrong with a client, and instead ask what happened to them that makes their behavior make sense in the
Yeah.
context they were in. So I hope that
Yeah.
students
That
these ideas.
that systems thinking, I think, is such a critical piece, right? It's the ability to say, okay, there are all of these threads that kind of tie together. They create a tapestry to help you better understand the patient's current context. And without that, you're operating without key pieces of information to help you understand what's going on with the client or a patient that's in front of you.
Right.
So, as students are thinking about the field, maybe entering the field and joining a doctoral program like the one there in Dallas, what is some advice that you would give them as they kind of go through consideration and decision making with respect to choosing a program?
Okay, so first, just kind of advice for being a graduate student. I'm actually going to take this from some of our students that what they say
Hmm.
to our incoming student is just to figure out what works for you in terms of organization and managing your time, because it is a lot and
Yeah.
you need to keep up with a pretty intense reading and workload, and then also plan time to take care of yourself and nurture those relationships that are supportive to you, because that's the long term, what's going to sustain you in our field, and you don't want to be spread too thin. And then,
Yeah.
if you can, start networking, participating in professional associations. I mean, even in undergrad, you can join APA or your local area association or state association to learn more and network.
Yeah.
Do you want me to go into why they might choose our school in particular, or our
Yeah.
program in particular?
Why should they choose a Chicago school? What makes it a great place to get your PsyD and clinical?
Yeah, so I think first of all, the PsyD degree is great if you're mainly interested in clinical work, but you're still committed to being a critical consumer of the research and
Hmm.
using evidence-based practice. So that's what we teach in our program. And I think you want to choose a program that's APA accredited, and we're excited to announce that our program has been moving forward with that.
Yay.
Yes,
That was
and
some great
also,
news.
yeah, consider like the people you're going to be around. So,
Yeah.
it's hard to tell when you interview, but the best you can kind of get a sense of if you would like to spend a lot of time with these people. And I will say I genuinely like my coworkers, and I'm proud, that our faculty has really very diverse experiences, that
Yeah.
people have worked in jails and forensic settings, hospitals, schools, universities. And in our PsyD program, and I think in most PsyD programs, you are able to still maintain a private practice as the faculty member, so
Mhm.
that like current clinical work enriches our teaching. We're able to bring in real
Yeah.
examples to our work. So I think that's a real strength of the PsyD degree, even over the PhD degree that I got personally. I don't know that my faculty were always doing a lot of clinical practice, and I'm really glad that I'm able to do that. And I think the students like that. Our faculty have a lot of great clinical experience to bring in to the classroom.
Yeah. I agree. You said something that I thought was really important, for students who are considering entering a program, and for students in the program, and why I think the program there in Dallas is such a nice option for students. And it's that idea of you're going to go into a program where there's a lot of rigor, there's high
Mhm.
expectations, there's a ton of work, and that can be really stressful. I still remember my first semester in my doctoral program and the stack of reading assignments. I'm like, oh my gosh, the level from my senior year in undergrad to that doctoral program went up substantially, and it was stressful.
Yeah,
But
it
part
is.
of part of kind of what helped me get through that were my peers and kind of the culture, the student culture there, and that's such a critical part, right? So if you're choosing to go into a program, I think it's good to, when you're going through the interview process, to ask some questions about, okay, what is the student
Yeah.
culture like? What does peer support look like here? Are there networks of support among the other students? I mean, obviously the faculty are a critical part of that, because you're going to be spending a lot of time with those faculty as well. So it's good to know, what are the faculty like, and how much do my professional aspirations align with the experience of the faculty? But that
Yes.
cultural piece, I think, is really critical too. And one of the things that I think the Dallas program has done a great job of is fostering a really kind of robust and healthy student culture.
Yeah, we have our student association that does a lot of things, and it's student led. So that's one option.
Yeah, I think the faculty in the Dallas campus, just kind of going back to the diversity of experience, and you've got some fantastic clinicians in the classroom providing that very kind of practitioner, scholar oriented instruction, really informed by clinical practice. But the other thing that I think is really cool about the Dallas program is you've got some scientific psychologists as well, who are maybe they're not necessarily clinically oriented. They're more steeped in kind of what you were talking about earlier, the social psychology side, the developmental side, the kind of cognitive neuroscience. So there's just a breadth and depth of experience among the faculty there that I think is wonderful.
Yeah.
Well, Dr. Pollard, thank you so much for joining us today.
Thanks for having me.